Good afternoon, New Mexico, and thank you very much for tuning in for another COVID-19 update. We also have the Lieutenant Governor, Howie Morales, who's joining us today, and leadership from the Public Education Department. We always have Dr. Grace, which I am very grateful for, making sure that we have an opportunity to discuss the modeling and the data behind the public health decisions that we make. But we also want to have an opportunity to answer questions about education today. I want to thank the person who made this incredible mask, Aurelia Davila from Ruidoso. She makes masks. I'm going to make sure that we get that information out to folks. It's beautiful, and I really feel incredibly protected, and I'm grateful for all the New Mexicans who have taken the time and trouble to share their craftsmanship and their desire to promote good public health practices as we all work to combat COVID-19. So thank you, Ms. Davila, very much. With that, I'm going to remove the mask so that I can be heard. We are, as folks pointed out, well more than 6 feet apart, which we're going to keep talking about because we aren't getting to many of the habits that will allow us to continue to safely, slowly, correctly reopen and deal with any number of issues that allow us to live with COVID-19 until there's a vaccine. So let's talk about today's case update. So today we have 11,192 total cases. 207 of those cases are in fact new today. We have 135 hospitalizations, 41 individuals on ventilators. Our total deceased is 485. Unfortunately, we are announcing 5 new deaths today. To date, we've done 314,670 total tests. We did more than 6,000 tests yesterday and are continuing to work towards well beyond our gating criteria of 5,000 tests a day. We want to get to 7,500 tests, and then I'm working diligently with our partners to get to 10,000 tests a day. And for those of you who may not have been watching every week with us, we talk about the number of tests is directly related to the ability to know where the virus is, how it's spreading, and what we can do to contain outbreaks so that we can live with the virus as it lives with us. I do want to point out something that we're going to go to Dr. Grace. I know that, frankly, and we should. The fact that folks text me, email us, write to us, call us, thank the doctor and his medical advisory team for sharing their information and working with the national labs and other private data firms to really look at what the trends are and what they mean for the future is incredibly important. We're going to talk about some troubling issues, not just around the country, which I think most people are aware in our neighboring states. We're going to talk about that. But in fact, the last several days, we're seeing an uptick in cases. On Monday, we had 128 cases. On Tuesday, 147 cases. Yesterday, 156 cases, with increases now in every single region. We can manage being flat. Our goal should be to reduce cases. What happens when we reduce cases? Fewer deaths, fewer hospitalizations, and we are managing the virus. So we are clearly not there, while that's not enough data to tell you what's going to happen over the next several days or what the trends are looking like, this is not what I think is the best news. And what you'll hear from both of us is that we think a lot of that are the personal mitigating behaviors, quite frankly, are not being met. So Dr. Grace, show us what's going on in the state and around the country, and then back to me.
Thank you very much, Governor. Just some quick updates today. We did a little bit more detailed data update just a few days ago. If we could go to the first slide in my deck, which has the 2 maps of New Mexico, and you can see the total number of cases as of yesterday, which looks similar with the darker shading being the greater number of cases. Mora and Debaca County still do not have cases. Yesterday's case distribution, you can see here, most prominently in the northwest, southeast, and then Doña Ana County, which is, and I want to spend some time today really focusing us on thinking about our borders, our northwest border, our southwest border with Arizona, our southern border with El Paso, Texas, and then our border on the east, which where New Mexicans connect with Amarillo and also with Lubbock, Texas. Just another update. We show this pretty much every press conference, but you can see the distribution of cases in the state. And sometimes we forget that it's really that working age individuals between 20 and 60 actually comprise 65% of all COVID cases. This is not necessarily more frequent in older people, but as you can see on the graph on the right, it's much more devastating with much higher mortality rates in older individuals. But it's really the folks between 20 and 60 who have the majority of COVID infections and unfortunately are more mobile and out and about more in communities and have more potential to spread the virus. Just a quick update on children. We've tested almost 1,300 children positive for COVID-19. Our cases represent 13% of the total New Mexico cases, up just a teeny bit. We've had no fatalities, thank goodness, and only 2 cases of the multi-system inflammatory syndrome that we know about that's associated with COVID, and those kids, I'm told, this week are doing quite well. But you can see that we're 5th in the entire country in terms of the percent of COVID cases that occur in children. This is the bad news slide for today, and last week we talked, if we go on to the next slide, sorry, I should be cueing you and I'm not. The next slide with all these graphs, a little confusing. I'm going to spend a little time on the red arrow, but focus you on the dotted blue line, which is the top graph, which is the 7-day average case count. We do that so it smooths it out a little bit and we can get a better idea of what's happening. A couple weeks ago, we talked about the fact that the big secondary bump on the right there, right near the left hand, sitting on top of that left hand side of the right arrow, was from an outbreak in multiple correctional facilities in Otero County. We thought that explained most of it, but I actually drew that arrow as an approximation of the slope of cases over the past 3 weeks. You know, we reopened on June 1st, and that red arrow encompasses the time period since then. And even without that spike there that you can see, there is absolutely no question that the trend in cases is going up, and we've seen a 4-day trend now increasing in New Mexico as well, which is very, very concerning. So this is a real issue. We're going to talk about some of the contributors to it. And the other thing is that while the Northwest, which is that orange line that went way up and we've been focused on for so long, came down in a little bit more of a bump and now is trending down. If you look really closely at the other lines in this graph, the other solid lines, all of the other regions are having upward trends. Very concerning, something we're watching very closely. And we'll talk a little bit about what's going on in each of those sections. If we go on to the next slide, it's a summary that we always show of the gating criteria, 6 different measures, but in 4 categories. I'm going to talk quite a bit about spread today, but you can see we're now above target. We changed the way we were measuring it to make it more sensitive to current changes, moved the target to 1.05. Remember, when we say 1.05, or today when we say the spread rate is 1.12, that means that every person with COVID on average in New Mexico is spreading it to 1.12 other people. Or if we had 100 people with COVID, they'd be spreading it to 112. We want that number below 1. Which means the virus, the rate of infection will go down. It has been below 1, but certainly not today. Testing, we're aiming for 5,000 a day. Governor mentioned we were over 6,000 yesterday, which is fantastic. But still, we're still falling a little bit short, but working really hard to catch up. On our contact tracing, we are in the median getting hold of people in about 22 hours from when we get the test result. And we're getting hold of, which is within our target of 24 hours, but it's taking us a little bit longer to identify their contacts and reach all those people. Typically, when you get a lab test, your phone number is in that information, but your contacts' phone numbers are not. So that's why it takes extra time to get that. And then below our delivery system capacity, we again measure our 7 hub hospital systems. They are over their baseline capacity of 230 ICU beds, but still below their expanded capacity of 460, so that's green, as is the PPE supply. And the reason we picked those 7 hospitals again is because the vast majority, well over 90% of our intensive care unit beds are in those facilities, and that's our most critical resource. And that's going to be an important thing to remember as we go on. I also just wanted to pause that we normally have 5 or 6 green boxes. This week we have 3 metrics that are not meeting target and 3 that are for the first time in a very long time. The spread rate on the next slide is graphed here. This is just a reminder, this is the website. You can go on the website and look at all these metrics to your heart's content. This is for the state as a whole. You can see we went down, we went back up, we went down, and now we're trending back up again with the spread rate a couple days ago when it was calculated at 1.12 or 1.117. This is a problem. We don't want the spread rate to be going up. We want it to be going down. And if we look at each of our regions, the Northwest is still the only one that has stayed below target for a couple weeks, but they are trending upwards, but they're below 1, which is great. Central region of the state also below our target of 1.05, but you can see significant upward trends in the Northeast, 1.12 to 1.34, significant upward trend in the Southeast, significant upward trend in the Southwest, who was green or good or below 1.05 last week, and now is up. So we're trending upwards in 4 of our 5 regions, which is another concern for all of us. I want to take a couple minutes and talk about our borders, because what's happening on the borders are important, and the reason it's important is when people live near borders, they often live in one state and work in another, go back and forth. That can't be avoided. But what you've probably read about and seen in the media recently is, and if we go to the next slide on Arizona, thank you. I have to remember to say that. Texas was one of the very first states to fully relax its statewide stay-at-home order on April 30th. They had about 1,111 new cases a day, and a couple days ago they were up to 4 times that number of cases per day. 4195 average cases over the past 7 days, and Texas hospitals are filling up and ICUs are getting very close to their maximum capacity. On the next slide, also about Texas, you can see where we have the counties are shaded by intensity, but there's a fair amount of case activity in the Panhandle, particularly close to the New Mexico border in the upper left. And if you look closely at El Paso, they have a fairly high case count as well. This is a prevalence rate, not case number slide, but El Paso, as of 4 days ago, had 4,488 cases total, 120 fatalities. And these black background slides you'll see for both Texas and Arizona are off the Johns Hopkins website, excellent COVID website, and you can see that cases were trending up. They relaxed the stay-at-home order. They continued trending up, and about 3 weeks later, completely took off. They took off so much that if you look closely, you can actually see spaces between the dots from day to day. The case rate is growing so fast in Texas. We know of cases in New Mexico of people who've gone across the border for family outings or reunions or other things in Texas toward Lubbock, toward Amarillo, and have come back infected with COVID. And that is just another way that our case counts do go up. Arizona, our second example, they lifted their lockdown a little bit later on May 15th. They were running 483 cases on average back when they lifted that lockdown. That's gone up by a factor of more than 5 to 2,700, over 2,700 cases. The total number of cases in the epidemic has tripled, and And here's another thing that I just want to mention briefly, because you're reading about this in the newspaper. It's the test positivity rate. A lot of folks will say, well, the reason we have more cases is we're just testing more people. I hear that all the time, and that is true. If you test twice as many people, you probably will identify many more cases. But the test positivity rate is the percent of those tests you do that are positive. That should stay the same or even go down if you're testing a higher number of people. And what we're seeing in Arizona here is that the test positivity rate went up by 22%, which to me means they're missing a large number of new cases and they're just not testing enough people. So that maxim, or that idea that just because we test more, we see more cases, that there's truth to that, but it doesn't mean that COVID isn't getting much worse. And in Arizona's case, this is an absolute disaster. In their case curve, if you look here, goes on the next slide, the Johns Hopkins slide on the right, you can see just an almost straight up trajectory of cases in Arizona just over the past 4 weeks since they relaxed their order. On the left side of this slide, you can see the number of cases, or actually the prevalence of cases. Again, just like New Mexico, the darker red colors mean a lot more cases. We have finally gotten our pandemic under control in the Northwest, although we're watching it very closely. But we also know of cases along the Arizona border where folks from southwestern New Mexico went to graduation parties in Arizona, brought back dozens of cases of COVID. There was a baseball tournament in Arizona people went to, played in the tournament, coaches and players came back with COVID cases. And so this is a challenge for us. You may have seen the headline, which I loved. And if you look at the next slide on the map on the right, it said a green island in a sea of red, referring to the fact that in the ready to open category, we still are fairly stable. Now, this does not include the last couple of days of data, but very significant hotspots in both Arizona and Texas. And because people move from state to state, this creates problems for us. Now, I got the states requiring masks map that you see on the left off a different website. So I'm not saying these two are perfectly correlated, but if you notice, about half the states that require masks are in the green. I don't see other states on this map that don't require masks that are in the green on the map on the right. And I still believe very strongly there's a correlation between wearing masks and preventing the spread of COVID. And so in my, I think, last couple slides, I just want to remind people that number one, nothing about the virus has changed. These curves really represent our behavior. They represent to what extent are we keeping the virus in check. And it would appear from our most recent data that we're not doing as good a job keeping the virus in check. Anytime there's any kind of reopening, that means people are going to have more contact with each other. We have to do even more, be even more careful. We have to do more of the preventive measures, not less. Reopening does not mean relax prevention, does not mean relax COVID-safe behaviors, does not mean relax wearing a mask. It actually means increase wearing a mask. If we all want to send our kids back to school later this summer, we all have to be wearing masks. We have to do everything we can. I would love to see 100% of New Mexicans deciding that the mask was not a political issue, but an issue about fighting the virus and something we do for our families and our communities, and everyone wear a mask. One thing, I've been working on an analogy, and I don't know if this is the perfect one, but I get up every morning and I put on sunscreen. And part of the reason I do is because I'm a physician and I tell my older patients they should all wear sunscreen every day. But if I go out and pull one weed, and that I see outside and come back in, other than having that sunscreen on, I don't need to do anything. If I'm going to go out and work in the yard for an hour, though, I take a water bottle. I want to make sure I've got a recent coat of sunscreen. I want to make sure I'm paying attention and I'm well hydrated. If I'm going to work outside all day, it's a wide brim hat, it's gallons of water, it's taking rest periods in the shade to make sure that I cool off. And as New Mexicans, as we're going out more, we need to do the same thing. Way more precautions. We don't want the state to get heat stroke or have a dramatic increase in COVID cases, and we just absolutely cannot afford the kind of results that Texas and Arizona are getting from their reopenings. We are monitoring ICU beds every morning in both Arizona along the border and also in Texas. They are filling very, very fast. In Arizona, we see data like 24 new ICU admits and 5 discharges every day for 7 days. Well, that cannot go on for much longer, and those cases will start being diverted to New Mexico, to our ICU beds as well. So we're not improving. We have to be vigilant. If we want to reopen safely and gradually, it's going to be slower. And based on our data, it's still the best thing you can do is stay at home. And then, of course, washing hands, keeping surfaces clean, not coughing into the air, but into a tissue or your elbow. Everyone should be wearing a face mask in public, particularly if we want to see schools reopen safely, and maintain that social distancing of 6 feet. And so that's my data and my interpretation of the data today, Governor. I'm back to you.
All right. Thank you, Dr. Scrace. All right. I'm going to actually repeat some of that because what we know about public communication and communication in general is the more often we hear a message, the more likely it is that we retain that information. And so I'm going to go to the first slide. We're going to talk about some of those states again. So we said that they're rising in our recent hospitalizations in border states around us, Texas, Arizona, California, and we also pay attention to what's going on in Utah and Colorado and Nevada. While we don't see some of the same stark differences, if you remember in the Johns Hopkins modeling map where we're meeting our gating criteria, it's a little bit old data, we're still in the green. The issue is that we need to look at what's going on as a country, because 2 things. People are traveling into our state. New Mexicans are traveling out of state. 2, when we can see decisions that are being made in other communities, other states, other jurisdictions, quite frankly, even other countries, then that is important and valuable information for us to compare about the decisions that we make and those outcomes. And it helps us to evaluate risk. The other thing about looking at the hospitalizations, Dr. Scrace said to all of us that, we know that we would be in overflow. So 2 things about that. 1, we would do that. There's no state that I know of that would look to deny care and support to any other state for any other reason. But in addition, it's a federal requirement. You can't deny hospital care to anyone. And that is a very effective, prudent standard, and we're going to adhere to that. So we're paying attention, and those issues then do impact managing and monitoring what's going on in our own hospitals. I didn't say it at the front end, but actually our hospitalizations are down. That is a good data point, but it is a moving data point, and so we're going to look at it every day. Now, what is the leadership doing in some of these other states that are seeing spikes? Well, in Texas, Governor Abbott has paused any more reopening, and he's basically said the stay-at-home order back. You have to stay at home. Now, I want to remind New Mexicans, we haven't lifted a stay-at-home order. We're clear that you have to get out, that some folks are now going back to work. Some of you were always essential workers. More places are open. But basically, that umbrella decision, stay at home, is still in effect because it is the most effective way to stop and slow the spread. If you don't go anywhere, that stops the spread. That's why we isolate individuals who are COVID-19 positive. You don't go anywhere, you don't see anyone, we know that you can't spread it. All right, in Arizona, inpatient beds, ICU beds, ventilators in use, emergency department visits for suspected and confirmed COVID-19 patients have hit their all-time highest ever numbers on Sunday. Direct result of a huge increase in the number of positive cases. California may need and must be prepared, according to Governor Newsom, to revert back to more aggressive COVID restrictions. And what does that mean? It means that we basically lock down our communities and states again. And when this is occurring all across the country, it has considerable impacts here. So what can we do about it? If I don't get to make decisions for Texas, and you don't either, or California, Arizona, what can we do? Don't go there. That's one thing that you can do. Another thing, we can continue to really look at furthering restrictions, not just the 14-day quarantine for flying in. What else can we do? Wear masks, wash your hands, stay socially distanced. If you do that, then while we're not an island, right, we're touched by what's going on in other states, we can certainly be different and have a different outcome if we increase our vigilance. Next slide. All right, so I'm just reminding you, the virus has not gone anywhere. I think there's a false sense of security now by, frankly, most Americans. The regular briefings that many of us saw by the governor of New York, Governor Cuomo, by the White House, by Vice President Pence, are diminishing. New York is now finally seeing its cases go down. The White House is not quite disbanded their task force, but we're not getting those regular updates. All the states, by and large, opened up. And so I think it gave way too many Americans this very false sense of security. We didn't see the kind of outbreaks in countries like Italy and Spain, you know, where I believe, I certainly did, watched with horror about the real life impacts in a country where you couldn't slow the spread or meet the healthcare demand of your affected citizens. So we need to pay attention. Doesn't matter that there's not a press conference every day. The virus has not gone anywhere. On June 23rd, we had 35,000 cases on that day in the U.S., the most in a single day since we were really focusing on our early outbreaks, late April. June 24th, 38,000 cases, another single day record. We're seeing exponential increases in states all around us. As of Wednesday, 26 states are seeing a higher rate of new cases as compared to last week. And in fact, the last several days in New Mexico, we're one of those states seeing an increase in cases. Dr. Fauci's warning to Congress, for those of you who did not watch that testimony, let me then quote him. We're now seeing a disturbing surge of infections. I'll say it yet again. You should not congregate in crowds. You should keep your distance. Here's how I would say it. You should stay home. If we stay home and we minimize our interactions outside of our homes and family units, we will do a better job in New Mexico. Next slide. All right. I still believe that we can manage until there's a vaccine. And you heard me announce that we've got guests today that you don't typically see when we do these updates, because I want to have a little time to spend on one of the most important subjects, whether or not we're dealing with the pandemic, and that's education. And we're also in a state where we know that the last decade has not shown the kind of results, attention, or support to New Mexico students anywhere in New Mexico. And this pandemic makes that even more challenging. We know that, and I'm going to get to all of this, we know this, that if we want kids to go back to school, and guess what? Our students want to go back to school. They're desperate to go back to school. They're socially isolated. It's not the same trying to do distance learning. And while I want to applaud all of the school districts and the parents who are doing their part in homeschooling, and all the educators that are working around the clock to make this work in a state that doesn't have effective internet access statewide. We just don't have broadband. We don't have the bandwidth to be doing this in the most effective way, which we need to get to in short order. We need to go back to school. We cannot go back to school unless we manage this virus and the spread of this virus better. So do your part. We owe it to every single student and their parents and their educator. And if we don't do a better job, we're basically signaling to New Mexico families and to our students that we don't care enough about their education to do a better job managing this virus. Wear a mask. I get sent pictures right before this press conference, and to protect people's privacy, I'm not showing them to you. I received 3 different photos, one from Tingley Beach in Albuquerque, one outside of a big box store, and one with construction workers near downtown Albuquerque. No masks. People are not 6 feet apart. They are congregating in crowds that are larger than 5. They are not wearing masks. They are not socially distancing themselves. They're violating all 3 of some of the most effective measures. All 3. The New Mexican just did a story saying that visitors coming into Santa Fe, thank you, New Mexican, are ignoring our mask requirement. It's required that you wear a mask, and worse, the worst examples of all is when people who are gently that good, positive peer pressure, please respect me, respect the state, help us manage, help us keep opening, help us manage and mitigate risk, please wear a mask. A woman was assaulted in Las Cruces for reminding a couple to wear masks. That's untenable in this state, and we will do everything in our power to hold people accountable. And if we can't get our mandatory mask requirement to work, then we're going to have to think about other options to make sure that it happens. If you don't wear a mask and socially distance, you don't support business. I support New Mexico businesses. They have struggled in ways that we couldn't even begin to comprehend. Too many businesses are either reducing their footprint, closing their doors forever, and not going to engage in any attempts to expand in the next year or 2. Not only is this remarkably terrible for New Mexico's economy, the largest employers in any state are your small local businesses. So it's a bit of a contradiction. Please stay home. But where you can, internet, telephone sales, curbside pickup, and then really work hard if you go in. Mask, socially distance, wash your hands, mask, hand sanitizer, be socially distancing from other consumers. This is how we keep them open. They deserve that from us. Notice that most New Mexico businesses are adhering to COVID-safe practices. Their employees are wearing masks. They've got partitions. They're telling you where to stand. They're metering people in. They're limiting capacity. We've asked them to do that, and they're adhering to those. The states that keep testing wildly, we're doing that, and widely, both, and isolating positive cases are going to have the best possible impact on their citizens by slow, steady economic recovery, going back to school, and making sure that we don't minimize your own healthcare needs and access to a fragile healthcare system. So if we accept that we're living in a COVID-positive world until there is a vaccine, this is going to require more sacrifice. All right, so why am I telling you this again? Because I need you to hear it again, because we're not doing it. New Mexicans actually have gotten really lax, I think, about wearing masks and taking this seriously, because it felt like maybe we were safe. Until there's a vaccine, you are not. We're not going to be in a position to move forward and make any tough, smart, effective decisions until we're clear that the virus hasn't gone anywhere, and that if we let up, it will spread, and that means that we slow reopenings, or worse, we have to go backwards and make different decisions about the businesses that are currently open. We would go backwards. And then again, reopenings are not an invitation. I said that at the front end, so I just really want to make sure that with all of these bullets, that every New Mexican, if you care about the state and you respect your fellow New Mexican, even if you disagree about wearing a mask, it's not a political statement. It's a public health requirement, and B, it's the only meaningful vehicle we have to live in a COVID world. There are other strategies, the distancing, the hand washing, but this is the most effective because it keeps the droplets from moving to another person, because I'm protecting you. All right, next slide. All right, so what does that really mean? It means that for the next few days, I want more data, and you should want more data too. That what we're seeing around us and what we're seeing right here in our own state is a clear indication that we are not quite ready to go to phase 2. Does that mean that your New Mexico Economic Recovery Council, your local leaders, and that this group are not working on phase 2? No, it doesn't. It doesn't mean that we won't get to phase 2. Frankly, it doesn't mean that I might not be making an announcement about additional openings in 2, 3, 4, 5 days. It depends on you. The more we do, the more likely it is in the next weeks of data that we can start to see mitigating effects. Or we can at least get a sense that behaviors are changed, that in the next week we feel pretty confident that after, right, they wear them, takes a week, we can see the results of those mitigating effects. So we're on hold. We're on a phase 2 pause. We're going to leave everything else the way that it is. We're not going to go backwards. I need you to do more. We're going to continue to evaluate the transmission rates and the alarm sustained rise in cases nationally for that additional week before making decisions about these 2 things: additional openings for businesses and raising the mass gatherings limit. I should point out that a couple of recent significant cases, one that resulted in a death in Albuquerque, is from going to Arizona for a family event and bringing COVID back. They have dire consequences. Dire. We can do better than this. The last thing I want here, the last thing that anyone wants, is to revert back to the initial public health order locking down the state. So our priorities remain the same. Please come get tested. We have capacity to do more testing. Please help us combat the virus. Provide positive peer support. Please, I beg you, New Mexico, we are better than the kind of hateful activities we have seen of late. We are better than attacking someone about wearing a mask. If you want a mask to be a political statement, write your political statement on your mask, but wear it. Use your mask as your First Amendment declaration, but protect your fellow New Mexicans. No one's going to argue with you about what you have on your mask. We might argue with you about wearing a mask. It is more important than ever, and please, please, please avoid groups. We're going to explore, like I said earlier, we can go to the next slide. Everything is back on the table about how we might meaningfully both encourage you and enforce mask wearing. If New Mexicans can't do a better job, then you leave me, unfortunately, no choice but to find other vehicles to make sure that we're adhering. Next slide. That the last slide? All right, thank you. They don't tell me, New Mexicans, when it's the last slide. All right, so I'm going to ask, I think we go to Dr. Scrace again, is that correct? We're going to go to Howie. Just so everyone knows that we are not rehearsing. Again, which I take some pride in, even though it appears sometimes that we could do a better job. And part of it is, again, why the data that we get is right before we come in this room. The issues that we know, we're looking nationally right before we come in this room, and then we check it over a longitudinal period of that week, and so we don't have the time to actually do the rest of it. But again, I'm delighted to have the Lieutenant Governor here today, Howie Morales. I know he needs no introduction, and I want to remind New Mexicans, maybe you haven't heard me say this about you. He is the only Lieutenant Governor in the country with a PhD in education. I believe that you might be the only leader in the country in a state government position that's not tied to education, to have been directly in education and also to have been a coach. He's got incredible experience and expertise, and it is not more important to anybody in this room today that we get education right, except for parents, than it is to the Lieutenant Governor, who's been leading our efforts for a moonshot in education. And I don't thank you enough for your incredible work, and this is a chance for me to do so again. Thank you, Lieutenant Governor, and thank you for talking to us a bit about education today.
Thank you, Governor, and thank you to all the people across the state of New Mexico who are joining us today. I come today not only as a Lieutenant Governor, but as an educator, as a coach, and most importantly, as a parent And as you're aware, the Public Education Department and the state of New Mexico earlier this week released the plan for school reentry. And with that plan that was in place under the direction of our Secretary of Education, Dr. Ryan Stewart, we have our Public Education Department team, as well as a task force that was put together, made up of community members, school nurses, administrators, charter leaders, and advocates and stakeholders who have been a part of this to help get us to the point where we're at in discussing school reentry. That was based off of 3 principles, and those 3 principles that we guide ourselves on are going to be to make sure, first and foremost, that we're going to keep the safety, well-being, and health of our educators, of our students, and our school personnel always at the forefront. To make sure that we can maximize as much as possible, maximize the opportunity for in-person instruction, and then to make sure that we can continue to use science and data to help guide in the decision-making process that we do for our schools. And Dr. Grace in a little bit will share a little bit more detail about some of the modeling that's in place right there. But we're grateful that we have the opportunity to have this discussion with each of you. But in order to adhere to these principles, it's going to look different than what we're used to in the schools. It's going to look a little different, causing us to be versatile, to make sure that we're creative in having the school systems in place to do all that we can for our students and to remain safe. So the state of New Mexico has chosen to move in a direction that's going to be a hybrid model. And what does the hybrid model mean? And as you can see on the slide, the combination of the hybrid model that we have is it'll limit the amount of students who are in the school setting. And this is done to make sure that we can maximize social distancing and that we can also have the opportunity to have students go to school a portion of the week, the other portion of the week to receive online instruction. And I think when you look and see the impact that that'll have, there's a couple reasons why this hybrid model is a good way to start off the school year. So as we indicated, as our goal is to move into the full entry capacity. In order to do that, there's things that each school must do. And there's things that we can do as New Mexicans as well. To move into that direction right there, what schools are going to be required to do is obviously practice social distancing at all times. We also have to make sure that we're doing all we can to mandate that students, staff, and those in the schools will wear face coverings. Also making sure that we're going to have, we're not going to allow assemblies to take place, PEP assemblies, for example. And then we continually monitor our staff by checking their temperatures and making sure that there are no symptoms of the COVID-19 virus. In addition to that, we'll continue with having rapid response testing and to make sure that we also have some of the testing that's in place that's going to be surveillance testing and so important as we move forward. And I want to make sure that parents and people across the state of New Mexico are fully aware that whether students are getting their instruction remotely or within this classroom setting, that we're going to always make sure that they have their meals, because we know how important that is to the people of the state of New Mexico. So I think that when you look and see, together with all these measures that are going to be taken by each school across the state, that we can, by half, greatly reduce the transmission rate of this virus. And I think that's something that we're going to continue to advocate to make sure that every single New Mexican does their part, because by going through this hybrid model, what it gives us the opportunity to do is it gives us, first of all, is to have the discussion, to get our students back into the school setting, and to make sure that we can assess the impact as reentry goes into place with the controlled setting, but at the same time is to make sure that we can monitor that there are no outbreaks across our school systems in New Mexico. In addition to that, we want to make sure that we are also being responsive to parents across the state, myself included, who's concerned about full reentry, to make sure that we're doing all we can to keep those children safe, staff members, and all those involved in the educational process. And then to ensure also that if for whatever reason in the state that we're going to have, if we have an outbreak or we have a spike in cases, that we can revert back to that hybrid model that we're starting the school year with. And I want to be extremely clear with the public and the people across the state of New Mexico. We're at this point today to talk about students reentering in the school setting because of the work that you as New Mexicans have done. You have allowed us to work together to flatten the curve. You have helped us to surpass the results of what other states haven't been able to do. But there's still more that can be done. And if we want our students to move into that full integration model, we want to have our kids back on the ball field, we want to make sure that we're doing all we can to keep everyone safe, then we must do our part. And so I ask you, just as the governor did, just as Secretary Grace had mentioned, to do our part with the simple things of social distancing ourselves, to make sure that we're also washing our hands and that we're wearing a mask. These simple yet effective methods will help us move into the direction to have our students have the education that they so truly deserve. So thank you, New Mexico, for the work you've done up to this point, but we recognize that we can do better, and we ask each one of us to do our part. With that, I'm going to turn to Dr. Grace so he can give a little bit on modeling, and he can discuss some of the work that's been done throughout the labs to show why the state chose to go into the hybrid model as we begin the school year.
Thank you very much, Lieutenant Governor. And I'm just going to briefly go over how we went about looking at all the different options for schools, and thank Paul Fenimore and his great team at Los Alamos National Lab. They have amazing ability to do analytic data. They originally, the modeling team spent almost the entire meeting, not this past Tuesday, but the one before last week, looking at a variety of models for reopening schools. And based on the extensive work Lionel did, they came to the table with 15 different models, and I think at the end of the discussion we asked them for 3 more models. But in large groups there was 4 or 5 days of school without any major mitigations, just send the kids back to school. And of course those all showed a huge uptick in cases and were immediately ruled out as being unacceptable. Second set was four different options with either 4 days of school or 5 days of school with mandatory masking, social distancing, rearranging classrooms to keep kids apart and out of groups. And those were better. They only showed a slight uptick in cases, somewhere between about level and a slight uptick depending on the nuances. The third set of interventions that they showed were hybrid models, as our Lieutenant Governor mentioned, where, and the devil will be in the details, but an example of a hybrid model would be half the kids come to school on Monday and Tuesday, which makes it easier to space them out because you only have half the kids. And then Wednesday, maybe the school is an off day, uses it for cleaning. And then Thursday, Friday, the other half of the kids come and do school those days. Meanwhile, the kids that are home in those days are doing distance learning, either with the class in session or other ways that the school districts are taking a look at right now. Though all of those scenarios were very tightly grouped and all showed a downward trend in cases. And then the last model that we've already tried for 3 months is just pure distance learning. And of course, there's less opportunity for spread if everyone is learning from home. But it wasn't really all that much better than the hybrid model. So, and another important point on the modeling that was really stressed during the discussion is what's going to happen in schools depends mostly on what's already happening in the community. If you're reopening the schools in the midst of a huge outbreak, you're not going to have a good outcome. And so that's why all the data we've presented today and all the encouragement to wear a mask so we can send our kids back to the classroom, you've heard. In the end, I think, as the Lieutenant Governor said, we believe that the hybrid model would be the safest model to start school with sort of that weekly evaluation of cases focused now on schools and kids and their families. And if it does appear that's going to be safe, if the medical literature is a little controversial, but leaning in the direction that kids don't transmit COVID to the extent that adults do, if all that pans out, then at some point when the data looks good, we're not seeing an uptick in cases, then we could go to a 4 or 5 day a week school model. So that data we haven't shared. I know that Nora would not have let me put this particular slide in the deck because I'm staring at it real close on my computer and it's hard to understand, but we have a simplified version. But the hybrid gives us a slight downward trend in cases, gives us some time to evaluate how that's going to work out. And I think most importantly, and not to rain on the parade of reopening schools, we have a teenager at home. We're excited about him being able to get back to school. But, you know, we don't know what's going to happen with the virus. A lot of very smart people think we're going to see a huge resurgence in the late fall or winter. And so having multiple models and having them set up and having experience with them allows us to be more nimble and move from one stage or one type of education to another, or combine different models as we need to quickly, rather than having to take a long time off to rearrange how we're educating our kids. So thank you very much, Lieutenant Governor.
What I want to do two things. I'm going to take my mask off and come back to me. I want to make sure that I'm going to ask you to send the camera all the way over so that New Mexicans can see our Deputy Secretary. Gwen Werneman is here, can answer questions. We are proud of the New Mexico team and want to introduce them to you as often as we can. And then back to me. Also want to make sure that folks know that we'll get this modeling data onto our website so that you can see it. It is hard, some of this data, to really get a good sense of it on the screen in the way in which we do these press conferences. And the last thing I want to say about education is that there's been a great deal, and I appreciate it, of New Mexicans responding about it. And there are a lot of parents who are really, frankly, concerned and don't know about work and childcare. So I've got parents who don't want school to start at all because they're worried about the safety of their families and their children. New Mexico has educators. We're the fourth state in the country to have the highest median age of educators. Knowing age is a factor for COVID-19 and the risks is another issue. We want to make sure that people are safe. We have parents who are really ready because their kids are ready and they want to go back. And we've got folks all in between. We also think that the hybrid model is challenging for parents to navigate. We are going to do everything in our power to minimize how difficult that navigation is, and are clear that we don't have enough childcare options in the current context of the state. And we've spent a considerable amount of time really showing that we can operate childcare safely, and I want to say thank you to all the child care providers in the state of New Mexico who have done a remarkable job and frankly have set the right COVID-safe practices for education by doing any number of things with the kids in which they're supporting every single day. So our goal is to not to have to be in a hybrid model. And our goal is not to have parents and educators and school districts and all of our public education workers challenged by these difficulties. But we are. No one expected a pandemic. We're here. We have a responsibility to deal with it in the most meaningful way. But I appreciate the dialogue, and you have experts in many places in state government who are clear that we have an obligation to do everything we can to meet this challenge head on and to do it in the most productive, proactive way for our New Mexico families and our students. But our goal is get to full-time in the classroom education as quick as we can. And what does it depend on? How well we do with our COVID-safe practices and how effective we are at maintaining and reducing the rate of spread of COVID in New Mexico. So with that, let's go to questions. I appreciate everyone's attention. And Nora, we're ready to go.
Thank you, Governor. All right, we are going to start with Julia Goldberg with the Santa Fe Reporter. Julia, you are unmuted. Go ahead and ask your question. Julia, I'm going to start with you. Go ahead and ask your question.
Sorry, who?
State government.
Sorry, Julia, you go right ahead.
Oh, thanks, Nora. Thank you very much. I have a few questions related to, related to gating criteria, first of all. Governor, I might have been misunderstanding, but it sounded as though there is the possibility of not opening schools if things are not going well. I just wondered if there's different gating criteria at this point for opening the schools, and then within that reopening plan, it sounds like there's different categories schools would be in, and I wondered what the criteria were, how that would be determined, and then does surveillance mean kids will regularly be getting COVID-19 tests at school? And then lastly, about the gating criteria, are all the subsequent phases for reopening the same gating criteria we're at now, or will they be shifting? Okay, I think those are all my questions.
Right.
Thank you.
So Julia, let's start with the gating criteria in general. You know, we set gating criteria that would allow us to make sure that we had a slow rate of spread, right? And if it gets below 1, it's incredibly, we're reducing cases. So we set a grading, rate of infection criteria. I think it was 1.15. Is that correct, Dr. Grace? But we did move that to 1.05 because we were meeting it, and you wanna meet those standards, particularly when you're reopening. Because if you're reopening, the higher the rate of infection standard is, the less likely you can stay open. But in general, we try not to move the goalpost. The grading criteria is really based on the same 4 principles. Rate of infection, we want that to be low. 2, number of tests. We have to meet, and we have to keep increasing the number of tests, because if we don't do that, then we're not doing effective surveillance, and we are not able to box in the virus when there's an outbreak. 3, I'm already forgetting the 3rd and 4th. Contact tracing. And contact tracing, we've got 230 contact tracers. Another 50 should be on the books by next week. We had 1,800 people apply. New Mexico, thank you for applying. Keep doing that. You know, we need to get to about 630. So the contact tracing requirements we've been slower at getting to, and there's no magic to that. You got to have people apply. You've got to have folks who are qualified. We've got to get them trained, and we had to have a company that can manage both the software applications of that, and you got to be able to do it more than once. That has to be the standard by which we are measured all the time. 4th one. Hospitals, thank you. Without seeing it, I've gotten very, very accustomed to having these right on the screen. And hospitalizations, why? Because if we can't meet the hospital care requirements, we overwhelm our healthcare system. So those 4 categories aren't going to shift. We know that those are the most meaningful categories. Inside there, we have to make sure that we're doing enough testing to actually keep introducing risk. If you have no risk and nothing opening, then you can have a higher rate of infection standard because people aren't moving around. Introduce risk, you have to have more contact tracers, you have to have more testing, right? You have to make sure that you're reducing that rate of spread by any means necessary because people are moving around. So I want to be really clear. The goalpost of the categories, inside the categories, is meeting what we know in terms of the data and making sure that that data is consistent with safe opening. The second thing you asked me about schools is, so the gating criteria for schools is the same as it is for any decision. 4 categories. How is the state doing? The difference about the kids in schools, and I'm going to have the experts talk about it, is really twofold. 1, while the data is now becoming much clearer, and Dr. Grace will either weigh in or correct me, both are invited because I want New Mexicans to get facts. That what we're learning about children is that they could be, as in some variations of the flu, super vectors, which means they are super spreaders. We're not actually finding that across the country and worldwide. 2, we are now also learning that kids don't seem, young people, to have the same negative impacts and the same risks if they actually become infected with COVID-19. What's different then about New Mexico? Well, we have more kids who are infected, so that's an alarming issue we need to get our arms around. And what else? 2, New Mexico is a multi-generational living arrangement state. So the opportunity for kids, even if they aren't super vectors, to take this virus and to spread it in high-risk areas, way too high for our comfort. The fact that our educators are older and in a high-risk group, another area for us to be really concerned about. And lastly, making sure that all the other, education staff are adequately protected. So that's how we're making our decisions, and the part that you probably were really getting at is that LANL, in terms of looking at what would happen when you introduce risk and you have kids going to school, and you have workers at school, and you have folks in close confined areas, even with social distancing measures, right? What happens? So their models suggested that the best way to manage spread was to go to a hybrid model. And I think that might have been the confusing, that we have the gating criteria and then we have LANL modeling. When you introduce risk in schools, what's likely to happen to your rate of spread or infection risks by doing so. That's how we concluded that we would go to a hybrid model. Lieutenant Governor, did I miss anything that I tried to, although I didn't answer each question separately, I tried to answer globally so that all 4 of your questions were answered.
Thank you, Governor. And I believe the part of the question was for parents and wanting to know about testing for children. And I'm going to go into some of the detail. I'll turn it over to Dr. Warnerman, who was part of that task force who discussed these issues. And so she'll share a little bit more of what those requirements are in detail.
Thank you, Governor and Lieutenant Governor. It is not a requirement for schools to test students. However, we are strongly recommending that they screen students when students enter the schools. So the difference there would be testing for the virus as opposed to screening, and that includes kind of all of the symptom checks, including temperature checks. So that was recommended strongly by the task force and is included in the guidance.
Thank you, Doctor. I appreciate that. I'm going to add this, that we're going to treat schools like we do any opening entity. So if you have an outbreak at a school, just like we do now for businesses, depending upon the outbreak, it's possible that you would close a school until it's cleaned, everyone's tested, and we're clear. It's possible that we isolate the virus, we do surveillance testing, we're clear about what we have, but what we allow the school to be open. And so it just really depends on what that outbreak looks like. We have a rapid response system for entities, businesses, and organizations that have a positive case. Those same rules will apply, which would mean staff and potentially students COVID-19 tested at a school with a particular outbreak or positive case. So I want to make sure that folks know that we would treat them exactly the same as all of our other entities. Next question. Oh, got one more.
Just a comment. You did a great job summarizing the gating criteria, Governor.
Or not.
The way I think about them is that when all the gating criteria are being met, that means that New Mexico can open some more. Because when you open some more, you get more cases. But if the gating criteria are being met, that means we have the capacity to handle those cases. And what's tricky about schools, particularly tricky about schools, 2 things is, one is I am predicting we'll find that kids don't spread as much. Very, very good news. And the other part is when we reopen schools, we're talking about 330,000 kids. So it's the biggest population move we will make. And so I think it underscores the need for New Mexico to be in a good place in general with the gating criteria, and also that we have that capacity for what we know will be an increase in cases.
Thank you, Dr. Grace. Next question.
Thank you, Governor. Next, I'm going to go to Michael McDevitt with the Las Cruces Sun News. Michael, you are unmuted. Go ahead and ask your question.
Yeah, hello, Governor. I wanted to ask about the prison facilities in the state, specifically the ones down here in the southwestern region in Otero County, which have seen huge numbers of infections. What is being done by the state to make sure that proper procedures are in place to make sure that these infections don't get worse? I know that one prisoner that talked to a reporter from a paper was actually put in solitary for talking to us. So what is what's being done, I guess, to make sure that the COVID-19 infection rate there is?
All right, Michael, thank you for the question. We did a specific corrections press update yesterday, and we did that because it's a huge area of concern. Any place where you've got large populations in very confined spaces, and we're required to provide, and we are, a safe environment. We provide food and the basic activities of daily living required. Then you're in a high-risk situation for infection spread. If an inmate in the state side was punished for talking to the press, this is going to be an investigation that the state will immediately undertake. I don't know anything about that and don't know whether it's a state side or it's the federal side. And this is a really complicating factor. We can't control the infection control strategies or the training or the limitations of visitors, and that certainly created more risk, and we're seeing that bear out in Ontario County. Notwithstanding, we have far too many cases and a significantly high positivity rate. We continue to do the infection control training. We continue to try to isolate that outbreak, and I think that the Corrections Department's going to have to at least explore the kinds of options that New Mexico explored in having a maybe COVID corrections only facility. Harder to do than I'm making it sound, no question. But these are really high-risk areas, and once that infection gets in, the best thing that we can do about corrections and long-term care facilities and hospitals is not let it get in the first place. And when you have any infection rates in any communities, they're high risk. I want to point out that you didn't ask this, but I want you to have it. Right? We've got several both federal and state facilities that have an infection in the facility. So we're doing, and I want to be really clear, we do incredible surveillance testing routinely with or without an infection. You have an infection, we increase that. 100% of the staff get tested. We do that immediately, and then we increase the number of inmates that we test. The more we know about what the infection rate is in a particular facility, the better we can try to address it. But we have limited options in that context, and it is something that we are gravely concerned about, and quite frankly, it is one of the major reasons we want to try to slow the rate of spread in every county, because it minimizes risk from a guard or a nutrition worker or a healthcare worker or these facilities that are right next to each other and someone on the federal side bringing it in. And it is an area that we continue to be concerned about, but there's no magic answer. Without a vaccine, we can continue to do those strategies. Everyone wears masks, everyone has gloves, we continue to do the infection control training, we do video work, we're doing video conferencing. People can't get in, you can't see your lawyer, can't see a family member, which is harsh. We make sure that their rights are being preserved by doing that on the telephone, and we're doing medicine via telemedicine. And even so, it's not enough, because this virus is highly contagious, can be deadly, and once it's in a confined area, it is highly problematic, with very few strategies that can manage it in the way in which I want it managed. I want it to be eradicated the second it's in a facility. I can't promise New Mexicans that we can do that. We haven't seen that occur anywhere, even in hospitals who arguably are experts at infection control. So it continues to be an area of high risk, and it's one of the reasons it's one of our most significant surveillance testing operations. So we can know as much about it as possible to allow us to create the kind of isolation inside a place where people arguably are already isolated. And for all the family members who want us to do more, I'm doing everything we know to do, and like I said, we're exploring now more options. We are open and doing research worldwide to see what we can do to mitigate spread. But I want New Mexicans to know it is an incredibly high-risk area. We have no control over the day-to-day standards of the federal prisons and detention centers, and it is an area that gives us significant concern. Did I miss anything? Okay. Next question.
Thank you, Governor. Next, we'll go to Jens Gould with the Santa Fe New Mexican. Jens, you are unmuted. Go ahead and ask your question.
It is an incredibly high risk area. We have no control over the data.
Jens, can you hear me? Go ahead and ask your question.
Detention centers, and it is an area that gives us significant concern.
All right, I'm going to mute Jens. I'll come back to you. I'm going to go to Matthew Reichbach with the New Mexico Political Report. Matthew, you're unmuted. Go ahead and ask your question.
Thank you. And yeah, I have a couple questions. One for the governor. As the state prepares a plan to reopen schools, is Secretary Stewart in the state? And if not, how has that affected preparations? And also for Dr. Grace, how many cases are you seeing that include travel to surrounding states? I know you mentioned those in Hidalgo County, but is the same thing happening in Doña Ana County and other border areas?
Thank you for that question. So Secretary Stewart is not in the state. I don't believe that that's hampering any of our planning issues. And for New Mexicans who want to know why that's a valuable question, Secretary Stewart's going to move his whole family. And he had a spouse, like many families do, that couldn't quite leave her job in order to move everybody here, and will not be lost on family members in New Mexico didn't want to interrupt a school year for their children. We also have significant now quarantine issues and figuring out housing issues. They are moving to New Mexico. We're going to be delighted to have them. With quarantine requirements, he is here as often as I expect him to be. But our deputy secretaries and Secretary Stewart, in the same way that we're all telecommuting to work, are responsible for as smooth as possible reopening of schools. And my expectations are high, and so are the lieutenant governors. And we don't think it will be without some bumps. We don't want anyone to hear that. These are really tough decisions, and they are completely different than the operation that any of us are accustomed to. But today, he is not here, but he is working, and I'm looking forward to having a situation in our state where I can personally welcome his entire family to the state of New Mexico and to our growing and improving public education system. Anybody else? Dr. Grace? Oh, yeah. I'm forgetting.
That's okay.
That's okay.
More coffee.
I just wanted to comment that I've been working with Ryan all week and had no idea he was out of state.
There you
I mean, the way we do work now is video conferencing, and so I've been in probably a dozen meetings with him in the past 2 weeks, and so this is news to me. How many people, how many cases are we seeing from people traveling to other states? Just a quick reminder that when this all started, that's how it started. People traveling from New Mexico State to New York and coming back and bringing the virus. And so I'm going to have to, I don't know the answer to the question. I can query our epidemiology colleagues. I already did. If I get an answer before we're done, I'll come back. If not, we'll look at that more. I know when they do the contact tracing and they do the contact information, travel is a question. I just don't know if we can query the database and get that out in terms of a number or percent. But we'll look into it. Great question, and thanks.
Okay. No, but we can generally answer that. That's how we had spread at the Navajo Nation. That's how we had spread in other areas like Laguna and Gallup by folks, truckers coming in. We know that that was a high-risk area. We know unequivocally that we had workers from El Paso. And this is not something where we're picking on any person or state. This virus moves with people, all right? We're seeing the increase in El Paso, Stampede meets, folks from Texas. We know that that is how it spreads. And so it is high risk, and it's a significant area of concern, and we can trace those right back, and I just gave you that example. How do I know it in that way? Because a family member reached out to me, and it's how painful is it to have a family member say, I regret making that decision. I can't imagine how painful that must be. And basically, our travel restrictions and stay-at-home orders are still in place, and our limits of gatherings. And so when you go to other states and they don't have those restrictions, you're putting New Mexicans at much higher risk. We know that unequivocally. And we're watching very carefully what's going on in our borders in Utah and Arizona. And Colorado for impacts, frankly, at some of our sovereign nations, which are continuing to have significant lockdown and measures to try to stop, and I think they're effective. And I think there's great leadership being shown at the Navajo Nation. But they have higher risk because of the decisions that other states are making. And we don't want New Mexicans traveling back and forth if you can help it at all, because it will bring the virus in and you're at risk and you're putting other New Mexicans at risk. Next question. And we'll provide more contact tracing information to you directly. Happy to do that.
Thank you, Governor. All right, I'm going to come back to Jens Gould with the Santa Fe New Mexican. I think we have that issue fixed. Jens, you are unmuted. Go ahead and ask your question.
Thank you. Sorry about that before. Hi, Governor. Hi, everyone. Thanks for the opportunity. I had two questions. Governor, you mentioned, you talked about potentially furthering restrictions if the case rate continues to go up, and also potentially alluded to potentially enforcing mask wearing, face covering wearing. So I wanted to ask what those restrictions might be, or what the potential enforcement might be if that were to be done. And then secondly, I was curious how much COVID suppressed, in your view, in the state's view, voter turnout on the Pueblos and tribal lands during the primaries, and what could be done differently to boost and solve that problem in November during the election. Thank you.
Thank you very much for your questions. So enforcement's tricky. I mean, the easiest way to enforce masks, and you're seeing more states go to mandatory masks and more states looking at enforcement because people aren't doing it, is to do personal citations, which we have the power to do. I take no pleasure in having any of our first responders and public safety officers provide a citation of $25 to $100 and whatever it is to any individual not wearing a mask, right? That I don't want to do that, but it has to be on the table if I'm serious about making sure that 350,000 students can go back to school and that I don't have to reverse the decisions that we've made about the current business openings and all of our phase 1 openings. We don't want to do that. No state wants to do that. I don't want to do that. The other way that you can think about enforcement is to work with local governments and business communities for investments in communities. If your community isn't ready for this next phase of openings, that region can be slower. I mean, we have to really think about mask wearing requirements has to be something that we take into consideration now for every single decision. And I was hopeful because I have to say, and I've been hard on New Mexicans today. It's a hard day when I see increases in cases 3-4 days in a row. When I'm concerned about that rate of infection, it's going up. When I have really tough questions, and they're fair, about what's going on in corrections, what the risk is in nursing homes, what the risk is in healthcare centers, what the risk is in dialysis centers, high. The risks are high. The risks in sovereign nations, high, high. We have a harder situation in our state just because of socioeconomic issues and the older population that we have in New Mexico. We have to do it better than everybody else, and we were. And then we just got really lax. And being lax is a signal to me that I have to not just remind you, but alert you that if we don't do better, I have to do the work of the decision maker, which is to make those tough decisions about making sure that I keep New Mexico safe. And whatever they are, I'll make them. So the goal is not to do any of that. But those are two areas, and to, we would restrict openings for the next set of businesses if we can't get people to wear masks. And that's unfair to these businesses who are hanging on by a thread and waiting. But if New Mexicans aren't going to wear masks and adhere to any of these social distancing, hand washing, protocols, then I can't let another set. I can't go to phase 2. We most certainly can't consider going to phase 3, which is larger gatherings, concerts and entertainment and the like. So those are two areas I'm looking at. Looking how we make investments in local communities, how we make decisions about phasing in other openings, and by citing New Mexicans. I don't want to do either of those. Today is not a decision to do either of those. We're hoping that New Mexicans will actually just adhere. Remains to be seen. We'll be back to you next week about what the numbers look like. And then the election. Now I've got Dr. Grace cueing me, which is fantastic. So if he was any further away, he wouldn't be able to do that. And I appreciate it. I think it's unfair that they can ask me several questions at once. So yes, we want to make sure that we do productive voter turnout. And for New Mexicans looking at this, in sovereign nations, we have real difficulty just in basic mail delivery. So if that's not a possibility, and because people didn't want to travel, and they didn't want to spread or have the risk of getting the infection by going to vote, that means that their right to vote isn't as protected as the rest of ours, given just the very nature of the living situations in our sovereign nations. We're going to have to analyze, and we want the different county clerks and the Secretary of State to help us now that if we still have a COVID-19 public health emergency, a pandemic, and by all indications, it certainly seems like that's what the national experts are telling us to expect. But we're not going to make a decision about the November election without having the data to indicate that we have to continue to do, right, absentee or that mail-in ballots. We're going to have to figure out maybe we have mobile voting in sovereign nations. We've seen that work in places like Bernalillo County. We're going to have to look at other strategies that prevent the spread, the risk of spread to the highest degree possible, but protect and preserve every New Mexican's right to vote. And I think it just depends, but we are going to have to be ready for more options for our sovereign nations, not less. And I really appreciate you raising that issue, and it's being raised both to the Secretary of State and to our level in the governor's office to make sure that we minimize the kinds of issues that we found troubling in the primary election. Next question.
Thank you, Governor. All right, next I'm going to go to Brandon Evans with KOAT. Brandon, you are unmuted. Go ahead and ask your question.
Good afternoon, Governor. I only have a couple of questions. First, wanted to give you a chance to address the half dozen bills that lawmakers sent to you directly or indirectly related to the two big things happening in the world right now, pandemics and protests. Just were you pleased with what they got done during the special session? That's question one. Question two, last time that we spoke, Governor, you were named as a potential VP candidate. Can you talk about your communication with the Biden campaign and if you're considering a VP or cabinet position at this time?
Thank you for your questions. I'm now definitely going to see if we can't limit the questions to just one per reporter, just for that. So everybody, you can thank Brandon for doing that to me. First, and by far the most important, look, I want to thank every single legislator who engaged productively in a special session, and the President of the Senate, the Lieutenant Governor, who did an incredible job, look, filling a more than $2 billion hole in a budget and doing that fairly and doing it in the context of we don't want massive layoffs and furloughs. That's not good for the economy. We want to meet, right, our public investment requirements. We want to make sure that we're supporting education and children, youth, and families. We want to make sure that we're trying to expand our footprint in the economy during, post-COVID. All of those issues significant. And I am, frankly, quite pleased. I didn't agree with every budget decision in the final budget that came up to my office, but it is, in fact, a negotiation. The legislators are the appropriators and the policymakers, and I would have kept more money in some of the line items for education. I think that you don't go backwards in investing for education. This is a state that did not meet its financial obligation to students and in the classroom. And while the pandemic has certainly created a shift in our ability to focus in the ways that we know really work, cutting those funds unnecessarily and too early, and I don't want New Mexicans to think that anyone here is Pollyanna about our budgetary issues and our economic risks. We're clear. But I'm also clear about who these investments are really intended for. and they're intended for the 330,000 children and their families in the state of New Mexico. So by and large, I applaud the legislature. I did ask them to help address civil rights issues and what we think is excessive force given the protests. So you asked specifically about that. I think we can do more in the area of bad excessive force policies like chokeholds. I appreciate that we're going to now require that we do body cameras. I also appreciate that we're going to make sure that we can't expunge that video footage, and want to make sure that every law enforcement entity is accountable in the state of New Mexico, and that we're clear about minimizing excessive force, and clearly that as we do that we recognize the risk, because we do have systemic racism embedded in every institutional aspect of our government. We have to get at it. I think the Commission on Civil Rights is going to be an incredible opportunity to do any number of things, including looking at qualified immunity and related issues, which are frankly incredibly complicated. But if you're a citizen, you don't want a complication to prevent the fact that you expect your family to be safe in every context. So we don't want folks to be able to utilize a legal mechanism not to be accountable, but we want to be balanced in that approach. I appreciate that they addressed our emergency orders in the pandemic, and we got to elections. I was really concerned about that. So I overall think this was a very effective special session, and really appreciate the amount of effort and debate in a few days and the amount of work that went in. And I am quite pleased.
Thank you, Governor. All right, next I'm going to go to Susan Montoya with the AP. Susan, you are unmuted. Go ahead and ask your question.
Yes, this is a question both for the governor and Dr. Grace. You had mentioned that, the last thing you want to do is be put in the position of having to revert and force a closure of the state again. So what's that trigger point? At what point do you decide, okay, we're in trouble here, we need to go back? What are the numbers that we're going to be looking at, some of the considerations that will force you to make that decision?
So let's start with that one first, and we'll make sure that Dr. Grace, who you can see I rely on and should, and I'm proud of that fact. I am not an epidemiologist, I am not a clinician, I am not a public health trained expert. He will tell you I pay a lot of attention to the numbers, and that is what I'm looking at. The number of cases per day, the positivity rates in the testing, the rate of infection or spread, where these outbreaks are, when they're in areas where it is very difficult to manage in a particular community, and we've talked about that, like Otero County. I'm concerned by that. I look at those numbers and those risks, and Dr. Grace and the medical advisory team don't let me just look at a day or two of data or 3 or 4 days. It has to be in 7 and 14 days so that you really do have a defensible trend line. And I need a week's worth of data, which is why we are pausing any announcements about phase 2 potential reopenings, even though we've done all the work and planning and thought about the COVID safe practices for a next set of openings. But given what's going on around us in the country, and given the end results that aren't good for reopening, I need to know that New Mexico will adhere to COVID safe practices in a business and out of a business. Personal responsibility and effective efforts inside each of our business partners that we're working with on a slow, productive, smart set of reopening standards. So that's what I'm looking at. The gating criteria, right, is an area that we make sure that we can manage and look at its impact on whether or not we're slowing the rate of infection. So if you have more infection, you better have hospital capacity. If your rate of infection is spreading, you better know why. That means you got to have contact tracers. What is happening? We got to make sure. And to respond effectively, we have to routinely be testing, and we got to be able then, if we've got an outbreak, to test that area as completely as possible. All of those efforts are critical in making next steps of decisions. Dr. Grace.
Yeah, thank you, Governor. I don't have too much to add. I think we do have gating criteria. If we got in a situation where we were not meeting the majority of them, actually we're not meeting the majority right now, and began to see the kind of case trends that we saw, that we're seeing right now in Arizona, what those result in is ICU beds, even the double capacity that we've developed being full. When that happens at 460 ICU beds, the next two people who are admitted to intensive care have to share a ventilator, and we don't want to get there. So I would say that it's a trend of not meeting gating criteria initially, and then that rise in hospitalizations, particularly ICU hospitalizations. And recall that that can come from New Mexicans filling those ICU beds, and it can also come from other states who are now who would be overwhelmed in their ICU bed capacity, transferring patients here as well. So I agree with the governor. We want to have a clear trend, not 1 or 2 days of data, but we watch these numbers every single day, and with particular sensitivity to ICU capacity as a late indicator of the other gating criteria failing.
And you know, I want to add something that I think is, I hope is valuable for folks who tune in for so long, and I'm grateful to you. The governor's bipartisan, National Governors Association, I'm lucky enough to be part of that leadership team, call it the executive committee. And we're not competing. There's not a governor in the country that doesn't want a strong economy. There's not a lieutenant governor in the country that doesn't want a growing, strong economy. There's not a governor or a lieutenant governor in the country that doesn't worry about its citizens in a variety of risk areas, right? We're in fire season. We worry about it all the time. We don't want this. And I raise it because when governors are saying, don't panic, and I agree with that message. We don't want anyone in the United States to panic. Being panicked doesn't do any good. Planning, being prepared, well, that's important and does make a difference. But when I hear in the media and I hear people debating, it doesn't matter if we've had an exponential increase in our cases because our hospitals aren't full. And even if they're filling up, we can double the capacity. And even if we do that, we can share ventilators. We can do this. And even if we do that, we can go to our off-site field hospitals if they're still in place in our states. True. But it means more people die. More people don't recover in the same way. More people have considerable risk. The long-term negative impacts on people's health who were hospitalized with COVID are significant. I don't want people in New Mexico hospitals because I don't want them to be sick. I don't want anyone on a ventilator. I want to make sure that we're always prepared to be able to meet their needs. But the best thing, we shouldn't be talking about, doesn't matter if we have an increase in cases. We still have good hospital capacity, and it is an important, valuable criteria that we look at, that we must pay attention to. The best thing I can do every day is say hospitalizations are going down. We don't have enough people in the hospital for COVID. This is good news. I don't want people in the hospital. Hospitals don't want you coming with COVID because they're worried about you. And it impacts their own safety. It impacts their ability to meet all the other issues. People still get sick. Doesn't have to be COVID. Unfortunately, people still have accidents, car accidents. People still have cancer. People still need surgery. I don't want anyone in the hospital for COVID. So I just want to point that out, that there seems to be this debate now that because we've created this surge capacity in our hospital systems, that doesn't matter if you have these exponential increases. It matters. It means more people will, in fact, go to the hospital at some point, and it means that more people will die, and it means more people will have chronic illnesses and lung disease related to COVID. And we don't want it, and we can do so much to mitigate and prevent it, and so we should. Next question.
Thank you, Governor. Real quick, just to our reporters that are on, one of you is logged on without a display name, and I don't know who you are, so please chat me who you are so that I can call on you. Next, we're going to go to Dan McKay with the Albuquerque Journal. Dan, you are unmuted. Go ahead and ask your question.
Hi, Governor. The spread rate took quite a jump over the last week. Can you tell us how real is the chance that New Mexico reimposes some of these restrictions that were in place earlier this spring? And then sort of looking forward, how confident are you that we can continue to reopen sometime in July without running into the kind of situation that's emerged in Arizona and Texas?
Well, because we've gone, Dan, thanks, we've gone really slow and we've been challenged, and I accept that. No one, again, wants to make these hard decisions. I want a growing, right, expanding, healthy economy. I don't want the reverse. No one does. But we've been really, really steady and slow for exactly this reason. I think the last couple of weeks have been states are open, people are traveling, we opened more parks. You know, it's that last set of openings, it's the election, it's just people are out more. That all by itself, I think, has created this impact where we're seeing an increase. The question is, are we going to see it flatten again? Now, we know that it always goes up a bit. I'm a little uncomfortable that our infection rate went up so much. But it always, every time I introduce risk, we're going to see an increase. We just are. We know that because people are moving around. But if it comes back down fairly quickly or it stabilizes in a week or so, then we know that our mitigation efforts are working and that we safely made those reopening decisions. I wish I had a crystal ball. If I knew exactly that after this press conference, I was going to go from, and I don't have a number, but based on what I saw today in photos from Albuquerque, and based on what I saw traveling to the Capitol today, I would say that I saw about a 30% compliance with masks. If that rate continues, I know unequivocally we're not going to see a reduction in the rate of infection. Impossible, because we're not mitigating. If anecdotally it looks like we're getting to 60, 70, 80% compliance, I feel incredibly confident that we can go to phase 2 in July, early July. It depends on New Mexicans. I can't predict compliance. I can ask for it, I can mandate it, I can tell you that I will keep pushing, including enforcement activities. And I want people to know what those would look like. I don't want to do it. Nobody wants to use resources to do that. If you don't have them, we will get them to you. Most businesses are still trying to provide them to you. They don't have to be medical masks. You don't have to spend any money. And you don't even have to agree that they make a difference. You just have to do it so that the people who do believe in the science are as protected as they should be, and think of it as an investment in kids getting to go to school. Think of it as an investment in getting your economy open. If you want those protections and freedoms and that independence, this is the ticket to doing it. So I don't know. Dan, I don't have an answer. It's going to depend, which is why we're not going to make new decisions today about phase 2. We're ready. I think businesses are ready. They're demonstrating that they can do COVID-safe practices. I heard about a hotel from the Lieutenant Governor in Santa Fe that clearly is not adhering. We have an investigation going. Businesses have to do their part. You have to follow the rules. New Mexicans have to follow the rules. Now, I'm not going to predict for you. I believe in New Mexico. Look, we're green. The data's a little bit old. It catches up with us. But even when we turn yellow or red, New Mexicans pretty quickly put us right back. I'm doing the part that I have control over. What do I have control over? Testing? You got to come get tested, but I go to you. And I committed to keep getting the testing supplies in the state. We've done that. What else is in our control, right, is the contact tracing. We brought in the company, we've done the training, we've doubled the number. The last time we talked about this, we were at 100, now we're at 230. We're going to bring on 50 more. I'm responsible. Government, we're responsible for those two parts. I have a high degree of confidence that we are meeting our gating criteria on both those efforts, and we've raised them. We're meeting those. The rest is up to New Mexicans. If they do their part, I feel pretty darn good that July can be a phase 2 opening. I guess maybe I'm spending too much time on this question, but the other thing is there are some areas that we don't have control over. That's what's going on in other states. And if those other states don't start mitigating the rate of infection, it will have an impact on us, quite frankly, even if we're not traveling. Truckers, goods, items have to move through those states. We're just at higher risk. And so all of us need to support all those governors who have made really tough decisions in Arizona and in Texas and in California, where it looks like they're going to go back a step or two. I appreciate those governors making those really hard decisions. I can only imagine that their constituents aren't very happy about that, but that will help New Mexico keep moving forward by the fact that bipartisan governors are doing what they need to do in their states as well.
Thank you, Governor. Next, I'm going to go to Matt Grubbs with New Mexico PBS. Matt, you're unmuted. Go ahead.
Thanks very much, Nora. Thanks for the opportunity. New Mexico has been releasing its data of cases according to counties. Our counties are pretty big, and I just, on a whim, checked out the available zip code data for my own zip code. It was pretty sobering. I'm wondering if that might be a more effective way to start releasing some of the information about new cases by communities as opposed to counties. Thanks.
So, you know, Matt, earnestly, I agree with you, which is why we put that data out. I mean, it's on the website by zip code. You know, we are constantly challenged, and I mean no disrespect. Frankly, I hope that that is earnest. And for all of our viewers, you know, I get questions that are hard to answer. I should. I appreciate very much that I'm in this leadership position. It's an incredible honor, even though it's an incredible challenge with the kind of civil unrest in the country and in our state that requires immediate and swift attention, and a pandemic, and of course now it's also fire season. And we have multiple fires that we are engaged in containing. So these are, no governor likes these sets of circumstances. I am grateful to the press pushing hard these issues, right? Their job is to keep us transparent, to ask the hard questions, and to engage New Mexicans so that they're informed. And we don't always agree, right? I think that this information means this, you might think it means something else. You keep those questions coming, even when they're hard. We didn't release the zip codes in a way that New Mexicans, without going to the website, can readily see, because often our partners in the press can figure out who it is. We have an obligation to the highest degree to meet the federal and state appropriate legal requirements to protect an individual's privacy. And in some of these areas, it gets tricky. And I'm going to also just remind folks about this. Earnestly, even with some of the issues and altercations and some of the tragic unfolding of at least the last large protest in Albuquerque with the shooting, incredibly disappointed and dismayed. There are risks. What happened at India Palace, untenable, unacceptable here in Santa Fe. Having a woman assaulted, unacceptable, untenable, hateful in Las Cruces. By and large, this is a state that has really embraced that our strength are our differences, accepting the fact that we have institutional racism, and expecting that we do everything we can in our power about it. But there is racism. And when people look at those zip codes, Matt, they often just make assumptions about a cluster in a neighborhood or in another, or in a sovereign nation. And I'm going to ask New Mexicans, and we need to think about that, if that's an effective tool without not meeting our responsibility to keeping private information private and not allowing any patient identifiers out. I need New Mexicans to keep in mind that while the very vast majority of us have made this a state that can be proud, should be proud, there are some of us who've engaged in the most hateful and despicable behavior I have ever seen. It shocks me. And that is an issue that we're going to have to be cognizant about. I have an obligation to protect New Mexicans, and I hope I have demonstrated that while we will be transparent, we want to know where these cases are, we want to make sure that we, as swiftly as possible, can address them. We will not tolerate hate, racism, negative or destructive behavior in this state. I will do everything in my power to keep everyone safe. So it's a good idea. That's why we collect it. Let me think about how I make sure that I do that in a safe and productive way by maybe stepping out a little bit further in that regard. So I appreciate the comment very much. And I appreciate the opportunity to talk about it because it requires that we have a conversation about it.
Thank you, Governors. A few more folks on here. Next, we're going to go to Chris McKee with KRQE. Chris, you're unmuted. Go right ahead.
Thank you so much. I wanted to ask 3 questions. 2 of them, I promise, are very quick. One of them, is anything going to happen with the state fair? Have any decisions been made about that yet? The second one, what about car travel out of state? Are people expected to do 14-day quarantine for car travel? I know that exists for air travel. Third one is a little bit more of a question with background. There's a racetrack in Roswell called the Alien Motor Speedway. They held a race last weekend with apparently at least dozens of fans in their grandstands. According to their Facebook page, they're going to hold another race this Saturday and they're inviting people to come with general admission prices on there. Seemingly the same invitation there. It's obviously a conflict with the state's ban on mass gatherings. Is the state responding to this specific gathering or others like it? And do you worry that this group's actions are sort of calling the state's bluff, if you will, or consequences on holding gatherings that perhaps are saying these public health orders have no teeth? Is that message concerning that they may be sending to other folks? Thank you.
Yes, I'm going to do the last first, and I've got partners who will help me make sure I answer all those questions, Chris. Well, it's very concerning, and we are citing these businesses, and we are engaged to the highest degree we're allowed to, daily fines. I will hold everyone accountable to the highest degree. We're in court on many of these. We will continue to go. I don't think that's the best way to deal with this. I think folks should adhere to the practices. That raceway is basically saying to every other business, I don't care about COVID, I don't care about people's public safety, and I really don't care about whether or not you get to be in phase 2 because I'm going to do whatever I want. And it's exactly those enterprises and businesses that create the risks to New Mexico and prevent us from succeeding at reducing our rate of infection. And we will hold them accountable. And yes, on that one, we know about it and we are investigating. You know, that's why we have an open line where people can tell us. We don't always know about it. We want to know about it. We send the state police and we work with local law enforcement, and we provide a cease and desist order to you and a citation. So we will absolutely be doing that. 2, I already forgot. Oh, the state fair. I'm telling you, I can't keep all these questions in my head, and I apologize to New Mexicans who expect me to do so. I could write them down, and I brought my glasses, so I will start doing that. The second one is we're going to make an announcement about the state fair tomorrow. Certainly don't want to steal that thunder about that announcement, but I think people should expect that if we are slowing where we are in phase 2, if we want to see some more data, if we're seeing that all of these large gatherings in other states who, as the national CDC folks are saying, prematurely completely opened their economies and had no restrictions on public gathering, what has happened? An explosion of cases. What do I want? I want kids to safely go back to school. I want to make sure that we get as quickly as possible to a 5-day complete school, right, effort. The kind of school effort that we're all accustomed to. That's what everybody wants and needs. Then having large gatherings is an unacceptable risk. So you'll hear directly about that tomorrow, but I think people are pretty clear, given the announcement about the Balloon Fiesta and others, that we are paying attention to the data and we are working hard to mitigate risk in the state. And Chris, you had a third one, didn't you? Oh, the travel. So you're right. We have a 14-day quarantine requirement for air travelers. We certainly made that requirement for people who were driving. We lifted that as we were opening up restaurants and having some additional capacity in hotels and are particularly in our small communities who depend on this kind of tourism. I will tell you that the calls coming into our office over the last couple of days have squarely been about requiring a 14-day quarantine, or to the degree that individuals would ask me to, and I would have the power to do that, to close our borders. So nobody in and nobody out. And I really can't do that for a number of reasons and federal law. I can quarantine folks, hard to always know, but again, I think it's an area we're going to have to look at. New Mexicans are realizing that while I mean no disrespect to our neighbors who want to be in our beautiful state, we do expect you to wear a mask. We expect you to be clear that when you come to our state that you might be creating risk. We would prefer that you don't travel here. We would prefer that New Mexicans do not travel out. Right now, what's going on in the United States, those risks are way too high, and I am evaluating what measures we might either reinstate or undertake that would mitigate risk from travelers from other states. I want to just point out that people, I think, are going to assume it's all cavalier. You know, we have families in these other states. We haven't gotten to see our cousins and brothers and sisters and mothers and fathers. We have spouses who commute to other states. We live along the border and live in another state but have a job in this state, and vice versa. There are some real challenges here. I don't want New Mexicans viewing or anyone asking me these questions to think that we disrespect, that we don't like anyone from another state, or that they feel that way about us. Not true. It's just inviting way too much risk. So I am evaluating what steps we ought to be taking. But if you are here and you are visiting your family, or you are just touring and on vacation, we expect you to adhere to New Mexico's COVID safe practices. That means wash your hands, wear a mask when you're in public, and socially distance yourself from everyone else. If you're not doing that, we are really disappointed, and we will look at measures that will prevent that to the highest degree that we can.
Thank you, Governor. This will be our last question, going to Andrew Hay with Reuters. Andrew, you are unmuted. If you want to mute us in the background there, Andrew, the volume in the background, and you can go ahead and ask your question.
Questions were asked, but it refers to, going back to that map that Dr. Grace showed of New Mexico, a little green island in a sea of red, and how you keep it like that. And you did say, you don't have any control over what other states do, but you do have control over people coming into the state. And we've seen New York, New Jersey, and Connecticut put in quarantines on states like Arizona and Texas. And I wondered, if you would consider some sort of, we've seen some sort of overland quarantine, people coming in from Arizona, people coming in from Oklahoma, Texas, having to do the 14 days that air travelers currently have to do.
Yeah, I'm going to go to Dr. Grace for that question, but I'm going to tell, yes, we made that an early restriction. We're willing to go back there again. And our message really is the easier thing to do is to ask folks not to travel. We know of a case in Hidalgo County where a family went to a family, I can't remember if it was a funeral or a wedding or graduation. So better that we have a celebration, but even so, they brought considerable infection right back. We don't want you traveling. Until there's a vaccine, it is way too much risk. This is just how it moves. And when we see the positivity rates in the states around us, we should be incredibly concerned because they will bring it here. And again, they can't help it. It just travels with you. Most people don't even know they have COVID-19. They're asymptomatic. I don't believe that the vast, overwhelming majority of Americans purposely spread COVID. They don't know they have it. And you can't see it, you can't smell it, and too many people don't even feel it. They're not sick. Risks are too great. So yes, unequivocally, I'm willing to reconsider that. which is why we are in a holding pattern. We're looking at these numbers, and I'm ready to make a series of additional announcements and decisions to mitigate risk. Dr. Scrace?
Yeah, I don't have too much to add. I think I was just going to say that the reason we're not moving forward today is because of what we're seeing in good part as a result of travel. One other comment about businesses operating events outside of the public health order. They wouldn't do that if people didn't go. And I would really encourage people, don't go. Don't go to something that's basically against the law, against a public health order, because it isn't going to be safe for you. It's not going to be safe for your family. And so I think that's a really important concept the governor mentioned a couple weeks ago, that we all need to be smart about staying away from places and groups that aren't safe. And really any big group of people right now isn't safe. Any even smaller group of people who aren't wearing masks, not safe. In New Mexico, 24% of cases where we have a positive test are at that point asymptomatic. Some of those people go on to develop symptoms, but we just don't know. And that bottom line of every time you leave home, assume, number one, that you have COVID and that everyone you contact has COVID. It's a great way to think about keeping safe, keeping yourself safe, keeping your families safe, keeping your fellow New Mexicans safe.
And we should probably end with this. And again, we don't want New Mexicans, again, disappointing mask compliance and some related issues. But when we were talking about people not traveling and looking at that data, aggregate data, never anybody's individual data about cell phones, so we could tell where you were traveling. We showed that New Mexicans, by and large, we had some problem days, but by and large, New Mexicans really tried hard to manage life with this virus. And I applaud you. That takes incredible discipline, and it's just going to get harder until there's a vaccine. Every time we make a decision, your discipline about COVID-safe practices will get more challenging. But remember this, for every case we know about, there's 10 cases we don't. 10 more people out there positive. And as we're doing that contact tracing, we can get them isolated. Just think about that in the context. Assume everyone you come into contact with has COVID, and assume that they are making that same assumption about you. And we'll stay in the green. We'll be able to do the work that we've been doing. Slow, smart, safe. And if we keep doing that, we're going to manage life in the most effective way, and we're going to protect so many more New Mexicans, and we're going to make sure that our kids, Dr. and Lieutenant Governor, can go back to school, and as quickly as possible can go to school outside of a hybrid model. That should be every single one of our goals. It is certainly mine, and I thank you very much for tuning in today.